At Frontier Psychiatry, we're well on our way to reaching all Montanans and even more in rural America with psychiatric access they need. And Charm is a big part of that. My name is Dr. Ghomi. I work with Frontier Psychiatry as their Chief Innovation Officer. We are a fast-growing, full-spectrum psychiatric practice, all virtual. We provide all subspecialties of psychiatry. We have 20 providers now, most of whom are MDs. We do inpatient coverage, 24/7 emergency room coverage, outpatient, nursing homes, Department of Corrections, jails, and so on. Our mission at Frontier Psychiatry is to make psychiatric care accessible to all Montanans by 2025. Montana has the first or second highest suicide rate, highest per capita Native American population, per capita veteran population. These are all populations that struggle to get care, that are underserved. Charm has been great in terms of customizing and helping develop features that we need, because we recognize that we're not a typical practice. I looked at several sites and organizations that review EHRs. Charm consistently ranked in the top 1 or 2 in terms of user friendliness. Their accessibility, their customer support just makes starting with Charm and then using it for the entire workflow, from patient encounter, scheduling, all the way up to billing. It's a very good option. So, to overcome some of the stigma with accessing psychiatric care, what's critical is our partnerships. So we have community partners, meaning FQHCs, community mental health centers, hospitals, emergency rooms, jails, you name it. When a patient comes into an emergency room in a rural area, they have one moment there to address their alcohol use disorder, their opioid use disorder, saying, here you go, here's some stabilization, go home. Oh, and I have a follow-up for you, but the follow-up is 3 to 4 months out, and that's average in Montana. That patient is highly unlikely to be engaged, because Charm allows a lot of automation, scheduling itself online. That helps our practice save a lot of money, but it also makes us able to schedule much faster and handle higher volumes. A lot of our facilities that have a high volume, they have direct access to Charm to input patients themselves. And on the other end, for patients to interact with, we actually did go the extra step of creating a customized Frontier Psychiatry app on the App Store, which Charm made and deployed for us. So the Charm portal has a nice wrapper of Frontier Psychiatry with our logo on it. So patients can just launch that, whether on their computer or on their mobile device. They'll open the app and they can schedule right there as well. For us, it's critical to have the API program because of our growth and our focus on technology to facilitate care. We are doing integrations with our health information exchange for the state, pharmacies, labs, other hospitals. HIE does allow us to view patient records from other places. So if a patient, for example, in Montana is seen at a hospital on the western side of the state, and then they kind of come back home to the eastern side of the state, and then they're seeing us for follow-up, now I can just quickly pull that hospital record online virtually with Charm and have immediate access to that information. All of our providers are registered for e-prescription and for the EPCS, which is for the controlled substances. That's, again, critical because it really makes filling prescriptions, refilling prescriptions much, much easier. I mean, from a couple clicks of the button when I'm in the patient encounter, I can pull up a medication, whether it's controlled or not, and send it on its way to the pharmacy. We've been growing anywhere from 20 to 40% month over month. From January seeing a few hundred patients to now seeing several thousand patients a month. The speed and ease of adding new facilities, onboarding new users, having hundreds of users now, all has happened, really in the last year. That's pretty hard to do. I've used lots of different EHRs. So in terms of growing this fast, I'm not sure it would have been possible. I actually don't think it would have been possible with another vendor.